Jody is out on a conference. Jody is out on a conference this week, so I'm going to be leading the session today. So welcome to the 8th session of the 3rd series of the PPCL ECHO program. I'm going to go over a few housekeeping items before we begin. First, please enter your name, title, organization, and email address in the chat box for attendance purposes. And just to say thank y'all for joining us today. We didn't know how many we would have attend because of the weather crisis impending on us. So thank y'all for taking the time to be here today. We appreciate it. This is our agenda for today, and we're going to do our best to stick to it. I'm also the facilitator, so I'm also keeping an eye on the clock today. So we do our best to try and stick to this schedule. I'm going to lead y'all in introductions, and then Dr. LaRose is going to lead our didactic today, followed by Dr. Renner is going to lead our case presentation. So thank y'all for volunteering for that today. We always, just a reminder, as we open the floor for questions, we always encourage our hub participants to participate first before our hub team contributes. And I'm going to introduce you to the hub team. Again, I'm Dr. Olivier. I'm a child and adolescent psychiatrist here in Lafayette, Louisiana. I'm in private practice for Bloom Mental Wellness. How about Lena? You want to introduce yourself?
Hi, everybody. I'm Lena Riggett. I'm a LCSW and one of the social workers for PPCL, and I'm also on the hub team, and I'm helping provide some IT today.
Thanks, Lena. How about Ashley Hutchins?
I am Ashley Hutchins. I'm a psychiatric nurse practitioner on the hub team, and I practice at Bloom Mental Wellness in Lafayette, Louisiana as well.
Thanks, Ashley. Dr. Queen.
Hi, I'm Dr. Queen. I am a general pediatrician and I practice obesity medicine as well for Our Lady of the Lake Children's Health, and I'm on the PPCL Project ECHO faculty.
Thanks, Dr. Queen. All right, and so just one last housekeeping thing before we begin, just to remind y'all about the PPCL consultation line. This is a no-cost provider-to-provider telephone consultation and education program. All of you that are registered for this program you can feel free to use it. You can call or you can fill out the online form, and it'll be reviewed by a mental health provider on the other end. So if you have any cases or questions about patients, please give us a call, and that's a free resource for you guys to utilize and use. I also encourage you in the future, if you have any cases that you want to present, we're always looking for cases. So if you want to contribute to these meetings in a low stress way, you can volunteer to do a case presentation. But I'm going to go ahead and turn this over to Dr. LaRose. Dr. LaRose, you want to introduce yourself, and you have about the next 20 minutes to present.
Yes, I am a child and adolescent psychiatrist. I've been in private practice for the past 6 years and just opened my own practice last year. And this topic is something very near and dear to my heart. Actually, I try to focus on sleep a lot with my clients. So yeah, that's about it. That's me. Okay, so you can go to the next slide. All right. Okay, so this shows state by state prevalence of sleep issues in children. And unfortunately, as per usual, Louisiana's not doing so great. Okay, so we have a pretty high prevalence of sleep issues in kids 4 months to 14 years. This is from just a few years ago, 2020 to 2021. So this is a very important topic for all of us providers in Louisiana. All right, you can go to the next slide. Okay, so these are some basic recommendations for children for how much sleep they need in a 24-hour period. So you can see that, with babies, we're aiming for 12 to 16 hours of sleep. And that drops steadily as they get into their teenage years. So teenagers are supposed to be getting about 8 to 10 hours of sleep. Anyone who sees teenagers, I think you can attest to the fact that the vast majority of them do not get 8 to 10 hours of sleep. I think I recently saw a statistic that it was between like 60 and 80%, I think, of adolescents in the United States do not get enough sleep. So this is a big issue for the kids that we see. All right, you can go to the next slide. So this is a chart just showing what sleep looks like. This is what we call sleep architecture. So all humans cycle through REM sleep and non-REM sleep throughout the night, and it changes, you know, the sleep architecture changes based on your age and your developmental stage. So it looks very different for children versus adults versus elderly folks. So you can see that for kids, we have, you know, bigger stretches between these sleep cycles. And you can also see something that's really important that I always tell parents and adults is that everyone wakes up in the middle of the night. Everyone does. It's just that most of us don't remember it. So, you know, for young adults, you're looking at about 2 times per night. I think between young adults and elderly, it averages like 3 to 5 times per night that we wake up. And then unfortunately, elderly people wake up a lot in the middle of the night. But for kids, it's normal for them to wake up at least once in the middle of the night. But the goal is that they're falling back asleep easily and hopefully not waking anyone else up in the house. But you can see that they're gonna cycle, you know, at least like 4 to 5 times throughout the night into like lighter stages and deeper stages of sleep. All right, you can go to the next slide. Okay, so common sleep problems that we see in kids. There's, you know, a problem with falling asleep, which we call sleep initiation, and then a problem with staying asleep, which is called sleep maintenance. Feeling sleepy during the day or daytime fatigue, nightmares or night terrors, bedwetting, which obviously can cause some nighttime awakenings, teeth grinding or teeth clenching, snoring and mouth breathing, sleepwalking or sleep talking, moving around a lot, so just like really restless sleep, and then sleeping during the day and staying awake at night, so having that like sweet sleep-wake reversal. Another thing that I didn't put on here, which is similar to that last point, is just like the delayed sleep schedule. So like for a lot of adolescents, we see that they want to stay up until, you know, midnight, 1 a.m. and then sleep until 10 a.m., which causes a lot of problems because unfortunately, we as a society have decided they have to be at school at 8 o'clock. So then if they're going to bed at midnight, 1 a.m., then obviously they're not getting enough sleep because they have to wake up early for school. All right, you can go to the next slide. So sleep hygiene, when we talk about sleep hygiene, that's basically just behaviors that we can put into place to try to ensure that we have a better night's sleep. So that consists of having a sleep schedule, so going to bed and waking up around the same times every day, a nightly routine that's consistent night to night. Healthy habits during the day is actually really important for sleep. And then optimizing the sleep space. So whatever area of the world this person is sleeping in, making sure as much as we can that it's conducive to sleeping. All right, you can go to the next slide. So sleep schedule, fixed wake up time. So there's a lot of research showing that wake up time is actually more important than bedtime in terms of regulating sleep cycle. So I always recommend to people when they're having sleep problems, for instance, you know, an adolescent or a young adult that's having that like delayed sleep schedule, that we focus on the wake up time first. So like setting that consistent wake up time every day. I try to negotiate with them on that, on what's a reasonable time to wake up. And then if they can be consistent with the wake up time, a lot of times like their body is going to adjust and get tired at a more reasonable hour at night. So focusing on wake up time actually can be more beneficial than focusing on bedtime in order to regulate sleep. Prioritizing sleep. So this I find is really, really hard for adolescents and young adults, especially adolescents, because nowadays they have so much homework, they have so many extracurriculars. If they don't prioritize sleep, then they will be going to bed too late every single night. That's a given. So really like teaching them that no matter how much more work they have to do, they have to go to bed at X o'clock, okay? This was something I had to enforce upon myself in medical school because it was like, there's always a mountain of work to be done, you never finish, and we just had to like decide at some point, I'm going to bed no matter what. Making gradual adjustments is obviously going to be easier than making big, drastic changes. So, when we are adjusting the sleep schedule, moving that bedtime or that wake up time by 15 minutes every few days instead of moving it by an hour or 2 hours. Okay, that's going to be much easier on people and they're going to feel it less as they go along. And then limiting naps for school-age children and adolescents, another big one that I see a lot. So I have a lot of teenagers who come home from school and they take a 2-hour nap and then they're doing homework until midnight, going to sleep at midnight, 1 a.m. and waking up at 6. And then like the cycle repeats because they're just chronically exhausted. So trying to cut out that nap so that they can get tired at a reasonable time at night instead of being awake as late. All right, you can go to the next slide. Okay, so nightly routines. This is something we do with babies, and it works really well with babies, but it works well with older kids and adults too. Doing things in the same order every night, and that's really dependent on the person and what kind of things calm them. So that can be a bath, and then brushing teeth, doing whatever face routine they do, reading a book or listening to music, drawing, listening to a podcast, listening to a book on tape, really anything that is calming for that person can be really helpful. But doing it in the same order helps our brain to, like, it kind of primes your brain to get tired earlier and earlier in that routine. So your brain is associating that routine with sleep. Doing this routine in low lighting as much as possible is very helpful. So it's just basically mimicking what's happening outside. Like your brain starts to release melatonin when the sun goes down. And if you can mimic that inside with lighting, so like, gradually dimming the lights as it gets later in the evening, that helps to tell your brain like it's time to calm down, it's time to go to sleep. This one is really a big sticking point for me. Turning off electronics before bed, at least 30 to 60 minutes. This is so hard for people to do, children and adults. Guilty as charged myself a lot of the time. But it really does make a big difference. And what I tell people, because I have a lot of patients who will say, well, I use, the night setting on my phone, or I use blue light glasses. None of that really can prevent interference with sleep, okay, with these electronics. So the best thing is just turning them off completely. And then implementing some kind of calming activity. Again, this depends on the person and what they like and what is calming to them. Sorry, that slide kind of cut off, but reading, praying, meditation, soft music, podcast, book on tape, coloring, drawing, whatever is calming to them that doesn't involve looking at a screen. So also another thing that's very important, and a lot of people don't know this, is one of the worst things you can do is toss and turn in bed. So I tell my patients, if you don't fall asleep within 30 minutes at most, it's actually better to get out of bed and do something quiet and calm that does not involve a screen, and then get back into bed when you're tired. So the longer you toss and turn, the longer it takes to fall asleep. All right, you can go to the next slide. Okay, so things that are going to be really important to do during the day in order to ensure good sleep at night: getting enough sunlight. So exposure to sunlight in the early morning is what helps the body to release melatonin in the evening. And it decreases what we call sleep latency. So sleep latency is like the amount of time between getting into bed and falling asleep. So sunlight is really, really important during the day, and we have found that early morning sunlight is really the most important. Another important time of day to get sunlight is in the evening. So right now it's not too hard to do. It's a little bit harder once we get into, the time change in the fall. But making sure that people get some kind of sunlight early in the morning and then in the evening if possible. Exercise, we know exercise does so many wonderful things for our bodies and our brains. And for sleep, it increases the amount of deep sleep that we get at night. So, exercise is just so vitally important. And then reducing substances that are going to interfere with sleep, nicotine, alcohol, caffeine. So this last point is really important, and a lot of, again, adolescents and young adults I find really struggle with this, is that the bed is only supposed to be used for sleep. If they are reading in bed during the day or doing homework in their bed or watching TV from their bed, then their brain is not associating the bed with sleep. If they limit the bed only to sleeping at night, then their brain starts to reassociate the bed with sleep. So I know that this is super, super hard, especially for like freshmen in college that are living in a dorm room. It's hard to separate the bed from the rest of their waking life. So, but if they're having sleep problems, we really have to crack down on that. All right, you can go to the next slide. Okay, optimizing the bedroom. So complete darkness is ideal. I know that this is really hard for the little ones, my kids included. Everybody wants a nightlight. I try to get people to wear an eye mask, like if they are afraid of having it too dark, or if they can't get the room completely dark, eye masks can be really helpful. Also, like having that light pressure on your eyes is very helpful for sleep. The optimal temperature in the room is 65 to 68. Most medical literature that you see will say 68, but it's actually 65 to 68. Reducing noises outside the room, and so if that's not possible, having earplugs, white noise, a running fan, something to kind of drown out any noises in the background. And then aromatherapy can really be really helpful, and it's better than given a prescription. So lavender tends to be very helpful, especially for like calming and soothing and inducing sleep. All right, you can go to the next slide. Okay. So conditions that commonly affect sleep in children and teens, obviously ADHD, I don't think that's very surprising for most of us. So about 70% of kids that have ADHD also have sleep problems. Autism, this is something that probably a lot of us have seen as well, 40 to 86, that's a big range, but 40 to 86% of those kids have sleep issues. I would say based on my client population, it's probably closer to the 86. Sleep apnea, I think this is something we don't tend to think about with kids, but it's definitely something that pops up and we need to look out for it, especially if a kid is snoring, if they're overweight, if they have a history of like enlarged tonsils, and then anxiety and depression. Just like we see with adults, those issues can affect sleeping kids too. Right. Okay, so I have a lot of parents ask me about melatonin. And I think my stance on this has changed over time. So up to 20% of children and adolescents use melatonin for sleep, and this rate has been steadily rising over the last several years. There's really not sufficient research on long-term use of melatonin in children and adolescents. Some research is suggesting that it might interfere with puberty and glucose metabolism. And supplements are not very regulated. So it's hard to know exactly what you're getting. And if what is advertised on the bottle is what's actually inside the bottle. So the actual dosage of what the child is taking might be different than what is listed. And I tend to see a lot of kids struggle, especially younger kids struggle with side effects like irritability during the day, headache, daytime drowsiness, so the kind of like that hangover effect, and then nightmares. I do see a lot of kids have nightmares when they're on melatonin. All right, you can go to the next. Okay, adolescent sleep problems. So again, that delayed sleep drive. Okay, so adolescents have a delayed sleep drive and melatonin release compared to other age groups. So their natural sleep schedule actually should be closer to like 11 p.m. to 9 a.m. But again, our society has forced them onto this adult schedule that doesn't really align with their physiology. So unfortunately, we see a lot of teens making up for that sleep debt on the weekends or after school, taking long naps. And then this kind of just creates a vicious cycle with sleep. A lot of our teens are using cell phones at night, more and more. And then again, they just, the demands on them in terms of schoolwork and extracurriculars continue to rise, and it's really taking up a lot of their time that should be spent sleeping. All right, you can go to the next slide. Okay, so hopefully y'all can get a copy of this and I don't have to, go through all of this and bore you, but these are just some questions that are really important to ask when there's sleep problems. So I think a lot of times when we're busy in our practices and kids come in that have sleep problems, we are kind of just like slapping the easiest fix on it and not really digging down. But I would say 9.9 times out of 10, there is something going on that's causing this sleep problem. So questions about like, where are they sleeping? Who do they sleep with? Are they staying in the same place all night, or are they leaving their bed and going somewhere else? Bedtime routines, what do they do once they're in bed? What do they do when they're having trouble falling asleep? Napping, asking about caffeine, asking about any other substances, asking about their physical activity outside time, and then obviously evaluating for any mental health conditions that could be interfering with sleep. All right, you can go to the next slide. And then in terms of like how to address sleep issues, sleep hygiene really should be the first intervention. Ruling out mental health conditions that could be interfering with sleep, helping the patient to reduce any kind of stressors, supplements only if the sleep has not improved with all of those above measures. If there's any concerns for sleep apnea, it might be helpful to refer for a sleep study. And then prescribed medications really should only be used as a last resort in kids. And I think that's it. Oh, and yes, check out my podcast that I just started releasing about a month ago. It's called the Little Brain Campaign. It's all about mental health in kids.
Thank you, Dr. LaRose.
Thanks.
Great job. Does anyone have any questions? We have like a minute for questions. All right.
I have a question.
Oh, go ahead.
Okay. So I, sometimes do the whole melatonin dancing around it, and yeah, I don't really think it's great studies, but are there any medications that you do use that are FDA approved for sleep problems in children or adolescents?
No.
There's not any. Oh my goodness.
Do I have some kids that are on medications at night? Yes. Are they FDA approved? No, I don't think so. I try to avoid it as much as I can. A lot of times when they come to me, they're already on these medications, and it's really hard to reel that back in. But I don't know if there's anything that's FDA approved for sleep in kids. No.
Okay. Well, thank you for your talk.
Sure.
Thank you. Well, we'll do wrap up real quick. Just to, let's see, let me pull my wrap up notes from Jody. Sorry, y'all. Again, make sure to enter your name, title, organization, and email address in the chat box for attendance. Thank you, Dr. Renner. That's a very difficult case, and I think we can all sympathize with you and appreciate the work that you're doing on it. So thank you so much for presenting. That opens up things we haven't talked about before. And thank you, Dr. LaRose. Dr. LaRose had to get off the call to go see patients, but appreciate her presenting as well. Let's see, I just want to remind y'all to complete the post-session survey to get your CEU, CME credits. The survey link, it will be in the chat, and it'll also be sent by email as well. Also, the recommendations will be sent by email as well after this session. So Thank y'all for your time. Consider offering to present a case for future sessions, because we really appreciate that. All right, y'all. So next week, ironically, I'm presenting on mental health laws and consent laws in the state of Louisiana. So kind of ties into the case too. All right, thank y'all so much. We're going to stick around. If anyone has any questions, we'll stick around for the next 10-15 minutes. But thanks.
Thanks, everybody.